A good evening. Thank you so much for joining us on The Fourth Estate, the show that critiques the media, how it covers stories and the angles that they've taken in those covering of those stories. This week, of course, we want to focus on the story that the media is slowly dropping the ball on, which is the COVID-19 story. The number of cases of COVID-19 is on an active increase, and we have with us today to discuss that Emma Inebiona, once a journalist, always a journalist, speaks for the Ministry of Health. We have Walter Mwesigye from NTV here. I want to start with you, Emma. What is the state of COVID-19 as of now in Uganda?
Thank you, Raymond. We are seeing an upward trend in terms of newly diagnosed infections. As we talk, the testing that was done yesterday indicates that we have 65 new confirmed cases from the samples tested, and Kampala alone has 42 confirmed cases. So that tells you that the surge in Kampala, we could be having a number of people who are infected.
Yes. Walter, you've been telling the story of COVID-19, and we feared for a long time that community infections would start to rise within Kampala. Would you say that now is the time? This is the time that we feared?
Well, definitely yes, because even the Ministry of Health has severally said they are not aware of, the source of the community transmission cases in Kampala. Just in Kampala, not to mention other districts, but in Kampala. And Kampala has a day population now could have dropped to about 3 million or about there because of the restrictions. But if the ministry itself, is worried about the source, then that means the time is ripe. They actually talked about, and this is actually now the time to, be extremely careful with whatever we're doing with COVID-19.
At the start of the COVID-19 story, the media really gave the story the weight that it deserved. It was dominating headlines. We were covering day-on-day updates about COVID-19. We were giving people tips on how to keep themselves safe. None of this is happening today. In any case, you can watch a bulletin and all stories pass by, and the only mention of COVID is maybe in guidelines for political rallies and the like. What has happened? What is it that happened in these short weeks that's made the media forget entirely?
Yeah, well, what actually has happened is, life has to move on. That's number one. And, the timeline of the country, our timelines as human beings, has to continue. It can't stop because of COVID-19. And what actually has happened now is that we are transiting into an election period. And it's quite hectic, demands a lot of time, demands enough attention. And that is what has happened. Media houses, we are, slowly shifting as journalists from the COVID-19 story to elections. And if you look at the previous days when we told stories about COVID-19, there was a total lockdown. So basically there was nothing between March and say May. There was almost nothing going on apart from COVID-19. So everybody was quiet and listening, like the president said. But now borders are open, business is running, people have to move on with their lives. So we are encountering different stories that we have to tell alongside COVID-19. And just one more thing. Today I, read something new from the World Health Organization, and they were saying science revolves, and as it revolves, it sometimes creates confusion, and probably some people may be left out, others may match up to it, and others may just, decide to do away with it. And I think that also is actually happening, that some people are tending to, relax a bit, stay away from COVID-19, and, take the measures personally at home, probably with their families. But then we have a group that has, just decided to, go live wire, like, they used to say out there in high school. So, like, for God and my country, what come may come. Yeah.
Emma, you've been in a newsroom before. You know how to capture headlines. You know how to make a headline. What is it about the communication strategy of the Ministry of Health that's let the COVID story drop the ball from the major headlines?
You know, we do not determine, from where I sit, we don't determine what will be the headline or what would be the lead story in NTV. But it depends on the newsworthiness of the story. Is it as hot as when man bites the dog? So apparently now we have, there is a political fever, our people are in campaigns, and somehow the media, unfortunately, has gotten distracted from the public health angle, which is COVID-19. And we are seeing there is an increase in the cases, which as corporate social responsibility, the media should ensure that the public or their viewers, their readers, their listeners are safe before they indulge into the fun-packed political season. So from really a social responsibility angle, I think the media needs to keep the focus on telling the people the evolving science around COVID-19 and also what they need to do to make informed decisions. I tend to agree with Walter. Previously, the risk perception, early March and April, the risk perception of COVID was very high. Even now, with us now registering some dates, the risk perception is coming up again, because now our call centers and also my personal line as a spokesperson is getting busy compared to the periods of April. So you never know, the science and also the trend can also influence the interest of the media. So my emphasis now is that the media need to keep eyes on the COVID story, because we might be headed into something different, given the relaxation of the lockdown restrictions. I know there are now many activities across the various sectors of the economy which also merit being covered, but we should not forget that there is a matter of life and death, which is the COVID-19 pandemic. So my appeal and hope is that let the journalists focus on COVID. And also as a ministry, we are looking at how best we can orient health reporters on understanding the science, because also there is a knowledge gap. The people covering this story, the science, they might have run out maybe on the news angles to do with COVID, but believe me, the news angles are so many. But with even this shift in the trend, having now, for instance, Kampala as having many cases.
You mentioned that the media should do this as social responsibility, but I wanted us to focus on the fact that one of the news values that every editor will look at when they're on the desk is prominence.
Yes.
And the COVID story seems to be prominent. It's just not coming up in the headlines. When you mentioned the numbers from yesterday, 49 cases, I think that's the single highest tally we've had in a single day. When you mentioned the deaths that we have currently, 13, and you look across the border in Kenya and see how far they're going with their COVID-19, we seem to be in the early days of where Kenya was, say, a month ago. Any editor would say this is stuff that's prominent.
Exactly.
Why then are they not capturing the story?
Exactly. That's why I'm telling you, the editors need not to take their eyes off the COVID story. It might be a bigger story, bigger than even the parliamentary or presidential elections. And that's why I'm telling you, it is important that our newsrooms keep tabs on the COVID story, and also knowing that we are headed into the political season. There's that kind of excitement. People want to hear the various manifestos, and this time around there's a little bit of competition. So, but we need to strike a balance and know that we still have a threat, a public health threat that is still lingering around. But as I told you, any newsworthy story will get coverage, and COVID is that newsworthy story that will bounce back on top of the headlines. I don't want to be a prophet of doom, but it is a story that is still with us here. So there might be currently journalism fatigue, but that fatigue will go away.
Walt has been itching to get back there.
And
yes.
I really want to come in there and tell Emma that we have actually not dropped the story or dropped the ball per se on covering COVID-19, because personally I've done that since the March of 21st, or even before, trying to get some information. But COVID-19 became prominent here in this country because of majorly two people. One, the president. Two, the Minister for Health. Those two people. They spoke about COVID. They told us about the dangers of COVID. Now, we reach a situation where those two people who were telling us about the dangers of COVID, are seen doing otherwise. And we have, people doing otherwise. Many people doing otherwise from what they say. And these are people in influential positions. So it becomes quite heavy and, very tasking for a journalist to try and change the perception of somebody in Mbari, where I was a few days ago, to wear a mask, when a person who was telling us about the dangers of COVID was seen in a crowd not putting on a mask, and days later you see somebody else, and the president who was saying COVID is bad, COVID kills, or you're going to get some deaths, patting these people on the back. So really it becomes very tough, where you should have taken a stand as the president of Uganda, like you took the stand and closed business and locked down the country. You now act otherwise, and you don't have these people punished. I think then that also changes the way the story of COVID-19 transpires in the country.
Emma, Walter seems to mention an important point, that in accountability, particularly media holding government accountable for its actions, the steam was taken out when the health minister, for example, went and donated masks in a constituency where she was running. She didn't have a mask on, but she was moving with crowds of people. The president has since stopped the 8 p.m. addresses that were coming in almost weekly. Is that the only explainer for why the COVID story has finally died down?
I really don't agree with that argument, because the media is expected to be not biased and objective. If you follow the science and you know that this disease is very dangerous, you need to tell the public that information, irrespective of what might be happening. And what I can say is that also the way the leaders, somehow there has been that, I think when the trend of the cases was, at least we saw that the trend was downward. The curve was flattening. So even the frequency of the addresses somehow went down, but that is in comparison with the other competing priorities, which is the political season, the electioneering that is happening. But largely my appeal to the journalism fraternity is to give non-biased. If someone acts otherwise and you need to tell the public, give them factual information to make the right decisions, then you do not have to fall because a leader has acted this way. You also now have to keep tabs of something that you need to tell the facts to the public.
But Walter said the thing is, if you continue to preach this message, it gets harder for the public to appreciate it if the minister is not practicing the same. It even gets harder to tell the story to an editor to say, let's do a story, for example, on adherence to masks within the city center, because the question will then be, If the minister is not wearing, then why should others?
I would like to comment on the story of the minister. I think it's a story that the media did not interest itself in to know the build-up of the pictures and the circumstances, how the pictures had gotten onto social media. I have been privileged to see the video of how everything started before that popular picture where she had pressed the mask on the table. And indeed, when you watch the video, she was doing sensitization of the population, and Lira was scheduled to get masks. So the people who wanted really to use it for political reasons looked out for that opportunity where she had finished demonstrating, because there was a social distance when you watch the full video of the happenings. But also, as the president said, there was that excitement. She went there a week after she had made a declaration. So she also did not anticipate the kind of excitement that will come with that kind of political declaration. So we should not really dwell on an incident, but give Ugandans or the population the facts, the science, and also help them appreciate, for instance, if we talk about community transmission or local transmission, what does this mean? If a case is reported, what else is supposed to be done? Those are the stories I want to see. But from where I sit as a former health journalist, there is a knowledge gap on the side of people following.
But Emma, we also have a duty to tell the stories you don't want to see, yes. Particularly stories like that one of the minister. And the reason why we've circled back to that story is because that's the story that took the steam out of the COVID-19 story. And the question that we're asking back and forth again is there a strategy within the Ministry of Health to speak to the powers that be about this political season, to say, this is such a vital season in the country's future, that if the COVID-19 regulations are not brought to the forefront, if it's not the first consideration, then the country is going to lose the fight against COVID-19.
No, if you've been following, the Minister for Information and National Guidance, even today made an address and also issued a press release with emphasis on what we need to do to protect our lives. And the same has been echoed by even the Secretary General of the ruling party, telling the population that whoever is in breach, whether of what caliber, should be brought to book. And also, the other day after the incidents in Koboko, where there was a procession, I'm glad that Honorable Aniti came out to apologize. So there is no difference on the issue that this is a time when everyone has to dance according to the guidelines that were issued by the Ministry of Health. Mistakes can be done, but mistakes can be regrettable, and how do we move forward is by doing the right thing, because even the other political players have seen activities on all political fronts where the stakeholders, the players, no one has a face mask, there is no social distancing, and it worries us as the Ministry of Health, given the upward trend we are seeing, and we might have a lot bigger task ahead of us.
Walter, yes, I want you to respond to him, but I also want you to respond to the fact that how different now can this story start to be told? Because the COVID-19 story is now very, very much closer to people. We have community transmissions. They are not just across the country anymore, they're also in the capital city where a lot of business activity is happening. How different can that story come back to the forefront?
I agree when Emma says that there's possibly a knowledge gap from the people who are covering the COVID story, which, should not be anything to, well, how would I say? It shouldn't be a very big deal, because COVID-19 is a new disease. It's a new infection. Globally, everybody is struggling to understand, including the scientists, who have, you know, much more knowledge than mere journalists who put writings on the paper. But to also hold the Ministry of Health, you know, accountable, the Minister for Health normally carries out addresses. The last one happened after about 31 days or thereabout. That's more than a month. If you look at the World Health Organization, they have a statement each and every week talking about previous things, current things, and new things, new developments. That is the World Health Organization. You know, we have our own scientists in the country. Whenever the minister is going to talk, she introduces a team of scientists. Sometimes she comes with new people every time she's coming up. And I'm thinking, if you realize as the Ministry of Health that there could be a knowledge gap, then how do we provide this knowledge? First of all, to the journalists, to help the people understand, you know, what we want them to know. If we are going to only hold meetings with scientists after 30 days, that's a 30-day difference of denying people knowledge or understanding what they're supposed to know. And in most cases, when those press conferences happen, we are not talking about, you know, we are not talking about new findings that we've discovered as scientists in Uganda. We are only talking about new cases. We try to explain some local transmission, as in we leave the journalists to ask the question of the ordinary person. But this is after 30 days. I think that's a very long time and something the Ministry of Health should change. Each and every day, actually every week, I attend a press briefing by AMREF and CDC and the Ministry of Health in Kenya. Every week, they are talking about new stuff. And this is not because they have, you know, many numbers or what, but it's something they decided to do to help journalists understand COVID-19 and how to, you know, talk to people about it. So this trend is also, you know, meant to change if we want our journalists to, you know, come out properly and talk about these issues. For example, if you look at something like dealing with COVID at home, this is something we've not talked about as journalists. And I was actually reading and I found some information, and, you know, that was a tipping point for me. So I have to look for the experts from the Ministry of Health. But I'm just thinking that the Ministry of Health should have thought about this before me. And in one of their press conferences, they say, you know, now that COVID is now closer to us, probably in the previous one, where they understand that we have community transmissions, they should now tell us how to deal with COVID at home. But if you leave this ultimately to the journalist, and remember that previously information was only limited to the minister and, you know, a few people, permanent secretary and the ministers, and probably the spokesperson. That was a limiting factor. If we have decided to introduce scientists every time we have press conferences, then let the scientists also, you know, have the liberty and freedom to explain these things. Yeah.
All right, thank you so much, Walter. We're going to take a very short break, but when we return, we'll have a second part of the conversation to discuss the government strategy and how journalists are covering the government strategy in dealing with COVID-19. Welcome back to the Fourth Estate. The last time we discussed health journalism with these very two gentlemen, African Center for Media Excellence has not yet produced their research numbers on the coverage of stories for COVID-19. Now we know what has come out of that. The top newspapers spent a lot of the lockdown period almost 20% of their time was dedicated towards the COVID story. And almost all editors now agree that the COVID story is the story of the time that they are telling. I want us to discuss now post-lockdown, the coverage of COVID-19 post-lockdown. And I'll start with you, Walter. There was a sense of accountability at the start. The minister would give a statement, and there were so many questions. Who's the confirmed case? Where are they being treated? Can we look at the treatment facilities? Do they have space? Do they not? Now, after the lockdown was lifted, there's very few questions that we're seeing from journalists on was the lockdown effective? What was the basis for lifting the lockdown? And is that basis, are we satisfying the basis right now? Why have those questions gone down now?
Well, I'll tell you, when I spoke to different people, some from the School of Public Health and researchers in the health field, they think that we did not use the lockdown time properly. That up to now we were still saying that we need about these beds of ICU, we need about this number of cars to help us go here and there, but there wasn't an exact or quantifiable item that we were looking at to say that if we have probably 14 or 15 regional referral hospitals plus Entebbe, then either we need to say Entebbe is going to handle this, Entebbe is going to handle COVID-19 patients only, or when we receive a patient of COVID-19 in Kabale, this is the ward that will handle COVID-19. As in, everything was makeshift. Until to date, just a few weeks ago, Kabale, which had trained health workers, received a patient of COVID-19, and they closed the entire hospital. We had 3 months of lockdown. The Minister for Health, in her address to the nation, called on to the health workers to look critically at cases of pneumonia and COVID-19, not to misdiagnose pneumonia as COVID-19 or COVID-19 as pneumonia. But we had the entire lockdown time to actually train people on what we want to see in COVID-19 and be exactly sure that this is a case of COVID-19, not to just gamble around. I'll give you just another example. We had health workers who were trained, according to the Ministry of Health, in handling COVID-19. Now, the Ministry of Health forgot that quite a number of people prefer to access health services from private facilities. I can tell you, if you look at all the cases that we've had in Kampala, they have been referred from private facilities. The Ministry of Health agrees that it was a failure on their part not to involve private health facilities. So it's not that we've not really, as journalists, held the ministry or government to account for its sins, but some of its sins are out there in the public, and they are saying, yeah, here I am. We had 3 months, but I'm still standing out. And I can tell you that we shall still see some of these things, because there looks to be a bit of a breakdown in how information flows from the Ministry of Health. We have a case in Namisindwa, the person dies. And the Ministry of Health says this person is a Kenyan. Some hours later, or probably a day, then you say, no, this actually is our person. The deceased was a Ugandan. There are people who have interacted with these people. So it becomes quite difficult, for you to believe anything or to actually sieve out the minimum truth from the information that you're receiving from government.
I want you to respond to that. The crisis of conflict that you have, particularly with communicating cases. We saw it not just in Amisindwa, we also saw it in Kampala, the case that was confirmed in Kampala. And the family said the body had been given back to them. They had gone and carried out their own Islamic ritual funeral, and very likely many of them could have gotten into contact with this body and gotten infected. Do you think that this crisis of communication that you've had with the ministry speaking, but the public speaking back with different results, do you think that that has created a sort of accountability gap?
No, I even don't call it a crisis. It is an evolving trend of COVID-19 in the country. Because at first, when there was the truck drivers, a few alerts from the community, this was the other way around. We would pick the samples from people, would have the people we are testing at the border, truck drivers, and now the story is evolving. That's why I'm emphasizing we need to, both of us, the people who are communicating and the people who are relaying the information to the public in form of journalism, to be appreciative that this is a phenomenon or a disease which is unprecedented, that has had variations in the science. It's not that we had abandoned involving the private sector. We issued guidelines across. When the Director General communicates, the communication cuts across between public and private, and everyone knew what to do. Yeah, but for like the instance of the case in Namisindwa, you have reports coming from the district, the DHO's office, the system in the local government, identifying a case that came from the private facility. So they do some preliminary investigation. Then we dispatch a rapid response team. So there are stages, and there is always fact checking. So for instance, if you realize that preliminary information that came out was not accurate, it is still our mandate as the ministry to give you, look here, we have since established this. And I think that's what Walter should be encouraging. If you find there was a mishap or a gap and you address it, there we should be given credit, because we work with facts and science. So if you find that there was a miscommunication, it is also perfect enough to come and explain. If an identity of a case was wrong, you come and clarify. The reason why, I think the reason why we have aspects that have not been handled well, for instance, the psychosocial team needs to do improvement. For instance, if a family loses a person and you have identified the family members, the first thing our teams that do risk-com and also psychosocial communication is to first communicate. So there are some levels of communication where we need to improve. I agree. Where you find a family has lost a person and they have not been properly communicated to what this means. So, and we are working around the clock to ensure that the various levels and the various people who need to know information about the case, they get the right information on time. It would be sad, for instance, Raymond, if you lost a close relative and you get to know the information from a distant party. And that's why we need to ensure that the members of the family need to get information, and accurate information on time, not learning that so and so has happened and you're listening it from the radio. With our new communication strategy, we are looking at ensuring that our information reaches everyone who needs to get that information. But I would like also to respond.
Emma, before you respond, the crisis that we're speaking of is, with every case, there are families involved, but it's also a nation involved.
Yes.
If you tell us that someone in Kampala died of COVID-19 at a hospital, And tomorrow our reporters walk to that hospital, and the staff there are not quarantined. The hospital has not sort of been taken through another COVID-19 test and checks for people who are inside the hospital. The family members who access the person are speaking to the press and giving press conferences.
No, there has been some kind of uniqueness in some cases where the testing of the sample happens even when the person has already died. So if you're picking a sample and you're waiting, for instance, there was where there was an oversight at Rubaga, the body was handed over when the sample had not come. Then the sample comes out positive. So that means you had to do the investigation backwards. So in some aspects, we also need more time. But you know, as the need for information sometimes cannot be patient. But for science, sometimes we need patience, such that the investigations are thorough and give the accurate information. So there are those scenarios, and that's why I was telling Walter, sometimes our teams need to study the information and sieve out right and wrong information, depending on what they have seen on the ground. And there is an aspect he brought that ministry presents scientists and we take wrong to come back. We present scientists to enable you know where to go and get information. But that has not been happening. The scientists sometimes are complaining. By the way, when are we going to talk to the journalists again? No one is contacting us. So there is also a tendency of really armchair journalism. I remember when I was still in the newsroom, I used to be with a list of things I could follow up. The proactiveness. You need to follow that, such that you become even a bother, because you want the scientists, the people in public offices to explain. But if there's this tendency of you will have to wait for a press conference, it is rather challenging. Then the population on the side of the journalism is being done a disservice. So I expect to be bombarded with questions, such that I link you to who is supposed to give you information, and also explain these myths that are emerging as the pandemic evolves locally. Because I am expected to know what you're telling me. I have read the strategic response, and it is saying X, Y, and Z. I've read the protocol for care and treatment. I've read the guidelines for quarantine. They talk about home quarantine, but it has not been effected. Why? The WHO has advised that there are new guidelines on surveillance which talk about X, Y, and Z. Uganda is not doing. So that is the kind of information, helping the public understand new information that is rubbing away the old information. But that has not been coming out. And when you go to websites, even WHO itself, it has rich information. Every day they are making some adjustments on their advice to nations. Even us locally here, we go through our protocols, we review the protocols. So that interested health journalist should be also on top of his game to keep tabs and also know what has changed. If previously discharge used to be after a period of days, and the discharge is adjusted to about seven days, you need to ask what has informed this decision. He talked about home care. Home care is one approach that our neighbors, Kenya, opted for. Asymptomatic patients to go into home care. And you might need now to do a comparison on, for instance, the approaches we have taken with another country. Then there you are taking stock of whether our actions were the best actions or they needed further improvement.
Walter, very finally now, we just have a few minutes before we close. The story is fast evolving now. There's many speculations that very likely we'll go back into a lockdown. If we look at other countries that have been where we've been, they've naturally reverted to lockdowns. South Africa, Italy, and the like. Germany too. What is the story that's going to be in the newsroom this coming week, particularly on the rising cases within Kampala?
Well, I would say, if you look at our statistics, just for the last 5 days, well, you include today, include results from yesterday that, Emma has just said, 60 plus cases. That really shows you that our curve is no longer flat or is no longer trying to even attempt to go down. It's now basically going up, and at a very fast rate. And if you compare that to the recoveries now have gone down very sharply. In the last 5 days, we have had about 140 plus new cases. But if you look at the recoveries, we've just had about only 3 people recovering in those 5 days. And previously we were joyous about 20 people recovered, 30 have recovered and been discharged. And now the deaths are also averagely 4 per week. So that clearly shows you that we are heading to a very bad situation. When you speak to these officials, including the minister herself, she is skeptical about a lockdown, even for Kampala alone, because they agree that, you can't keep people in a lockdown. But I was with her in Imbali, just 2 days ago, and she was telling me that they are now going to do a survey for Kampala to establish where COVID is and who has the most COVID, in terms of locations. And they also, sent out a team to the arcades and the malls to actually follow up and see if these people are following up with the SOPs. And some of the things that they are developing are the penalties for people who have refused or who are not following the SOPs. So, going forward, we are likely to see people getting in jail or probably, paying some few shillings for not wearing a mask properly, for not washing your hands in public, stuff like that. So people out there must be aware that COVID-19 is real and, it's here with us. We have to live with it, but then we have to follow the guidelines. Otherwise, you're likely to face a penalty if you're grabbed.
Emma, very finally, if you could pitch to the editors in the newsrooms, what's the story that the Ministry of Health wants the newsrooms to carry Monday to Friday in this coming week?
The newsrooms need to help the population understand first the importance of prevention. What following the guidelines could keep them away from. If you follow the guidelines or the measurements, which is hand washing, wearing your face masks properly, and also keeping a social distance, you are likely not to end up in a hospital. But also the newsrooms need to tell the people, our patients, for instance, still asymptomatic, or the trend is now showing symptomatic, because I'm getting a number of calls of people who want to do a test following presence of symptoms that are consistent with COVID. So a number of people now are calling. So we need to know, our patients, for instance, in the hospital, are they the bigger, is the bigger percentage still asymptomatic or they are symptomatic? If they are those ones who have degenerated into ICU, how are they doing? And also, he talked about an issue of bed capacity. Most of our facilities of recent have been with fewer patients. You find maybe Mbale has more patients, but other patients, Moroto, Soroti, they have 0 cases. Also, the good news, the consistent good news somehow contributed to the complacency or the non-adherence to the SOPs, because I think out there, the population sometimes thought at one time that we have already defeated the virus, which is not the case. The virus is still here with us. So the newsrooms need to be proactive. Do enterprise stories. I remember that word when I was still in a newsroom. Get out of the comfort zone, find new information, help the population understand the various studies. When you go to these journals, the science journals, they have new information. The WHO website has fresh information, giving advice to countries and also advising, because now countries are going into opening the airspace. There's new advice. How do you deal with the airspace? What are the trends? Having opened up many sectors of the economy, what are the scientists observing, and what advice do they give vis-a-vis the advice that was already given? Because earlier WHO had warned that we should not rush into relaxing the restrictions. But we are cognizant that also our economy, many people were pushed to the wall, irrespective of the adherence to the guidelines. But also most importantly, at least the media houses should have that corporate social responsibility of, at least on a daily basis, availing the population with the basic preventive measures, and also how they can adhere to these measures, irrespective of the fatigue. Yes.
All right. Thank you so much, Emma. Of course, it's been the fourth estate. If we could tell you 4 things, particularly to journalists who go out to cover these stories: please wear your face mask, wash your hands, sanitize your hands if you must, but also keep a social distance. And let's fight COVID-19 together. But this has been the fourth estate. We've been critiquing the media angles that the media has taken in covering the COVID-19 story or not covering the COVID-19 story. We've talked very much in detail about the angles that have been missed. We've talked in detail about the stories that should be covered, the accountability that should be offered by both the Ministry of Health and by journalism all across the country. Have yourselves a good evening from us to you.